First of all, I am Dr. Ahmed Shaheen. I am interventional cardiologist, act as interventional consultant cardiologist in Alexandria, Egypt. I have been graduated 2003, after which I received my structural training in cardiology in one of the most prestigious and busiest cardiac centers in Egypt and the Middle East. It is National Heart Institute in Cairo. After that, I was finished my membership of Royal College of Physicians of London and Glasgow. After that, I was hiring as an assistant consultant in one of the most state-of-the-art cardiac centers in the region. It was King Faisal Cardiac Center in Saudi Arabia. Then I returned back to my beloved country, Egypt, and I act as an interventional cardiologist in Alexandria, Egypt. Actually, my experience with TCTAP and complex PCI started last year. I was discussing with one of my colleagues, and he advised me to publish my case in such mega events. At that time, I published 2 cases. It was about complex PCI and left main intervention in the COVID era. And I successfully presented this case, and I exposed to a very scientific and academic discussion. I personally gain a lot of experience from such discussion. I would say there is many aspects I like it most in TCT Virtual 2021. Number 1 is accessibility. It is easily accessible to everyone. Number 2 is time management. I have learned how to manage your time and how to be adherent to your time limit. Number 3 is a scientific material availability. Now you can open YouTube and you can see all the scientific material very easily and accessible. Number 4 is discussion. Actually, discussion was highly professional. Firstly, I was not planned to be a cardiologist. I was one of the fans of the surgery. I remember 15 years back when I received my residency in one of the district hospital as a cardiology resident. And I was surprised. It was really a very small hospital with a very limited cardiac resource. At that point, I was decided to change my career to surgery. But one of my colleagues was a resident in one of the biggest and busiest cardiac centers in Egypt. It was National Heart Institute. And he called me, advised me to come and see the real cardiology. After that, I joined National Heart Institute. At that time, I exposed to, I would say, the real cardiology intervention. At that time, I was insisted to invest my career and improve my interventional skills. Cardiology is one of the specialists that is highly dynamic and a lot of advanced state-of-the-art articles and state-of-the-art techniques. And by my as my personality is usually dynamic, so I like it too much. I hope a good health and healthy life to my family, my colleagues, and my tutors. Career-wise, I would like to publish much more articles and case reports in a different meeting and the conference. And I hope I will receive a structural training in structural cardiac intervention in one of the eminent cardiac centers in the world. And finally, I hope I will offer a highly standard medical care to my patients in my beloved country. And thank you.